So we start with the history task. One, two, three, go.
Hello, I'm Dr. Suleiman, one of the mental health doctors.
Hello, doctor.
Hello. How would you like me to address you,
You can call me Simon.
Simone? And do you prefer to be called as she or he?
She is better.
Okay, thank you, Simone, for coming today. I understand that the GB has referred you because you want to take estrogen. Would you like to share with me more about your decision about this?
Yeah, no problem. But I hope that you help me with this because I really need it.
Sure, I will do my best to help you.
Okay.
Well, so can you share with me your thoughts about this decision of taking his
Well,
estrogen?
I feel that I am a female trapped in the male body, and I really feel that it is a very important step in order to feel that I'm in my right body and also to have my life as smooth as possible. But doctor, I really, I'm not crazy. Why am I referred to psychiatrist?
Or about really what you're telling me, Simon, is usually we people with such difficulties experience some emotional difficulties, and I'm here to listen to you and see if we can do anything to help. Would that be okay?
Okay.
So you mentioned that you feel that you are trapped in a male's body, which is I can imagine is very difficult. Could you share with me more about for how long you've been feeling this way?
It has been all along, doctor, all along my life. I've been feeling this way since a childhood.
It's a childhood. And can you tell me more about when did you start to
Well,
experience this?
during my childhood, I used to play with girls. I used to dress like girls, talk like girls, and it was all my life like this.
Oh, and how did your parent react to that?
Nobody understood me, and I was suffering, and I don't want to go through this again.
I'm sorry you had to go through this difficult time. And how things progressed after that, Simo?
Well, during the puberty, I felt horrible because now my body changed dramatically towards a thing which I don't like, and I did not feel comfortable.
And how did you do to overcome this stress?
I tried to hide all the signs of the puberty because this is not me. It's a different body, but I couldn't.
And what's your sexual fantasies at that time?
What do you mean by sexual fantasies?
When what kind of sex you prefer, or what are the kind of sexual thoughts you are having?
Well, like a girl, like any girl.
Have you been with any relationship?
Yes, definitely.
Okay, and have you taken any steps after that? Just
After what?
just toward your goals. I mean, after puberty, how things progress since the puberty till now?
As I said, I'm feeling I feel that there is a difficulty more and more in my life because of this body which is not suitable for who I really are.
Mm. And have you taken any steps to change your sexual
Yes,
appearance?
yeah.
That can.
I like to dress like a girl, and I also like to be called a girl, and I also like to talk like a girl. I try to be myself, but yeah, my body is totally different.
Mm. Have you tried to change your name, for example, in your passport?
Yes. As I said, I prefer to be called
Oh,
Simon.
all right, okay. Well, so how this has impacted you, Simone?
Well, I've suffered a lot because I've been bullied all my life, and people don't understand me, and people are away from me because of the contradiction between who I really are and how I look. And I'm really suffering because of this.
I'm sorry to hear that. Has it impacting your mood?
No, no, but I feel frustrated. I'm not depressed, but
And are you
frustrated.
able to enjoy things?
Well,
Are you able to enjoy things?
Well, yes, definitely. If I'm environment and people around me accept me as I'm really who I'm really are, it's no problem.
Right. Okay. I'm glad to hear that. Well, so sometimes when people passing through a difficult time, they might experience strange experiences like hearing voices no one around. Has it been the case with you?
No, no,
Right. And have you ever felt distressed to the degree that you don't want to live anymore?
no.
Okay, great. Okay. Well, Simon, so what are your goals moving forwards? Do you know what might be the
Excuse me.
consequences of this?
Well, I understand what the sequence and I've read about it.
So
1 minute
what's
remaining. 1 minute remaining.
so after taking estrogen, do you have other goals like having surgery, for example?
Yes, definitely. I want to change my body totally towards the body which I prefer.
And what do you think might happen if like your expectations didn't meet?
Well, I'm sure that there is a mistake. Or this my expectations are not met because I'm honest and I feel that I am not a. This body is not the thing which is really all. My body is not me.
Hmm, right. Yeah, so sometimes people maybe cope with difficult time by drinking alcohol or use any recreational drug. Has it been the case with you, Simon?
No.
Okay. So thank you for sharing all this information with me. I know that's a sensitive issue, and I'm glad that you opened up and spoke with me. And what you have mentioned is a suggestive of a condition called gender dysphoria. Have you ever
Time,
heard
time,
about this
time,
before?
time, time. How do you feel about what you did? Give me your feedback.
All right. So I think I've covered the puberty time, childhood time, puberty, impact, mood, psychosis, alcohol, his understanding about the surgery, the estrogen and surgery, a bit of managed risk as well. So I feel that I maybe covered about 60 or 70% of the station.
Yes, as I said before, doctor, pay attention to the following. It's not about what are you going to do? It's more now about how are you going to do it? How? Okay. You showed good empathy, but sometimes your communication skills should be sharpened in this particular station. You have just because you bluntly approach a sensitive area about her sexual life or his sexual life in a very, very blunt area. Take permission in the beginning that you are going to help him or help her in the best way. ربنا يسامحنا على الكلام ده, okay? And try as much as possible to be sensitive and ask him that you might need to ask a particular sensitive questions in order to help him in the particular. So in the very first beginning, because you are going to approach sensitive areas, take permission, okay?
Okay.
Not at the end. You took permission at the end. This is not the best way. So it
Mhm.
should have been in the very first beginning, okay?
Okay.
So I hope that you all give him some feedback in the in the chat section, and let's see how we can do this station according to the to our to our yes, okay. Okay, so this is, as I said, this is a station which needs a lot of communication skills. Okay, you must show empathy while you are hearing the complaint, and show empathy when you are sharing the difficulties. When she shares the difficulties with you. Okay, and very good that you started by asking her, him, how would you like to be addressed, whether he or she is better for him to be addressed with. Very good. It's very good stuff. Okay. This is our, when you see history task, your goal is to reach a diagnosis at the end. You should have a very organized and constructive dialogue in order at the end, from all the information you gather, you reach to the diagnosis. So there are particular steps which you should do and go through systematically in order to make sure that during 7 minutes you are going to reach a diagnosis. So the first thing you introduce yourself, and as you can see, don't underestimate this. step in this particular station. The introduction is very important. If you don't introduce yourself properly, you might lose the patient from the very first beginning, and for him, you are not sensitive enough. You don't understand his condition. He will be very defensive, and you will lose the station. And nowadays, unfortunately, the Royal College puts considerable amount on the feedback of the role player in the evaluation of the candidates. Some of the candidates shared with me his evaluation. He did not pass. They were all related to the communication skills and the evaluation of the role player rather than the evaluation of the consultant. Now the complaint. There is a particular, and we'll go through the complaint, the details of how to take a complaint. So there is a rule for the introduction, which will go through the complaint. Then you are going to take the symptoms of syndrome. After taking the complaint properly, a syndrome will be apparent for you. Take the symptoms of this syndrome thoroughly to make sure that you cover the task in depth. Then ask for the comorbidity, very important. Very important to ask about the impact, coping, and the risk. This is an area which the candidates always forget. What is the impact of this particular problem in his life? One of the criteria of any psychiatric diagnosis is the degree of impact of this problem on his life. Okay, any psychiatric diagnosis. So he must ask about the impact and how he's coping and the level of risk. Past history and family history, very important. And at the end, definitely the candidates who can reach the step of delivering the diagnosis are going to have a better results than those who just gather information and they lose time and they don't have the time to deliver the diagnosis, okay? You don't need to talk about any management in this station. Now, pay attention, because I understand that in your clinic, we don't do this. We just mix the history with the management in order to make sure that the patient understands all the problem and how it is solved before leaving the clinic. But in the CASC, this is not the case. You are required to do a particular thing in the clinical scale, in your clinical skill profile. Here it is history. So don't talk about the management at all. If you talk about the management, nobody is going to give you any more points. So the very first basic rule of the introduction is to introduce yourself and greet the patient by his name and explain to him why are you talking with him. Though this is a very simple rule, many candidates do not know how to do it. Again, introduce yourself. Many candidates forget their name. They forget the name of the patient. They forget the name of the patient, or they forget how to explain why you are talking with the patient. Start the station from the very first beginning. When you explain to him why you are talking with him, you enter the station directly. Don't ask him, so do you understand why you are talking with me today? This is nonsense. From the very first beginning, go through the station. He has been referred to you because of so and so. Use this information to explain to him why you are talking with him. Why am I referred to psychiatrist is a very important question. You are going to get it through all the liaison psychiatry. So you understand there are many ways, but you must use the issue that mind and body are one unit, and definitely before taking any serious clinical intervention, there must be a psychiatric evaluation and take a permission to proceed. Okay, your answer for this question could have been better. Why am I talking to a psychiatrist? Okay, now the complaint. There is a rule for the complaint. You now want the rule is you want to know the current clinical situation. You want to know the onset of the problem, the course, and how was he doing before the onset. Okay, so what is his current situation? So he mentioned that he wants to take estrogen. I know that this is a sensitive issue. However, in order to help you, I would like to discuss with you more this issue in details. And then ask him, why do you request to take the estrogen? So you want to know the current situation. This is the first point. And then you want to know the onset. Since when did this situation, the issue start? Did this start yesterday, 1 month ago, since childhood? If it is real gender dysphoria, it should have started since childhood, as far as I know. Then the course, you want to know how it increases. If it increases with time, it's stationary. Any particular things which makes him feel more like a female. Okay, anytime he felt the opposite, a very important question. Okay, so the problem of feeling that he is a girl should always be there. He will always feel that he is a girl, stationary, and this is him. Okay, and you want to know, so well, in this case, there is no particular before the onset because it started since the childhood. But sometimes you need to ask this question if it is not a childhood problem. So, but bear in mind that the rule of the complaint that you must ask always about before the onset. Okay? So you don't need to ask this question in this particular disorder because it started since child. Now, the symptoms of the syndrome. Well, you might be, well, not very understanding what in particular you're going to ask in this particular situation. Any psychological phenomenon, in order to make sure that you are going to cover it in depth, you can dissect it into feelings, behavior, thinking, and childhood. Okay? You want to know exactly how is his feeling or how are his feelings in this particular psychological phenomenon, how is his behavior, what are his thoughts regarding this particular problem, and if there is any childhood issues related to this problem. Okay? Any psychological phenomenon, if you are not happy or feel it is difficult for you to ask what is the particular questions which I'm going to ask, remember this rule. Ask about the feelings, the behaviors, the thinking, and the childhood. So what are the feelings which we are going to ask him in this station? You want to know his feelings towards his body. So how do you feel toward your body? Any part of your body which makes you uncomfortable? Which parts of you as a person you address as feminine and which part as masculine? Okay, you can just omit all this question and just ask him how do you feel towards your body. Okay, if you forget all these questions, only ask him, so how do you feel towards your body? Now, how does he feel towards females and males? Because, and this is definitely a very sensitive issue, because if he's gender, definitely he's going to be more attracted to males in relation to his sexual life, but it's going to be attracted to females as part of his gender type. Okay, so so how does he feel towards the females? Any sexual attraction towards the females supposed to be not the case in this issue. And towards the males, he feels that he is sexually attracted to the males. Okay. Just enough this question. You don't need to check if it is variable with time. So feelings, how does he feel towards his body? How does he feel towards the females? And how does he feel towards the males? Females, he's supposed to be one of them, so he feels that he is in they are the same type, but towards the male, he feels sexually attracted. Now, you want to know, ask number two about the behavior. There are particular behaviors which you should ask about. So, how does he feel towards what do you feel towards your body affect? What does your body affect? Well, no, sorry, this question is not. So we want to know if he is socializing as the as a male or female. So it's not how the feel towards your body. Okay, just okay. So you want to know the behavior. How does he dress and socialize? So the question was set wrongly. I copy pasted something else. So how does he dress and socialize? Does he feel sexual excitement when he dressed like a female? Did he change his gender in official papers? Does he have a girlfriend or a boyfriend? So this is the behavior. Okay, definitely he is going to address and socialize as a girl. He does not feel sexual excitement when he is dressing as a female. It is part of his routine, not because he is seeking sexual pleasure. And definitely, he will also try to change his officials according to the new identity. And finally, if he has a girlfriend or a boyfriend. So this is the behavior. So that last thing, not last, but thinking is very important. So you want to understand what does he think about the estrogen and hormonal therapy? Does he know the complications of this step? And what are his goals from the estrogen? What does he want from this particular estrogen? Does he want to take it just temporarily or just as a part of his changing his own identity? And ask him about the effect of liver and the bones. Very important to mention this to him. Okay. Ask him about the plans about surgery, and ask him if he understands the complications of these surgeries and if he understands that all these changes can be irreversible. Okay, this is the thinking part. And childhood, and ask him simply if there is anything in his childhood related to this problem or any traumatic events. Are with me all, Candice? Okay, I
Yes.
hope that the questions which you are going to ask in the transsexualism are clear. They can stumble in this particular area when they want to take a history in depth related to this particular problem. Okay, you want to ask about the feelings, how does he feel towards his body, enough to ask about how does he feel to his body, how does he feel to the genders around him, the males and females, and if he is having if he's having a sexual excitement, sexual attraction towards them, and his behavior and thinking, and finally childhood. The comorbidity is very important. As we said, depression, psychosis are very common. Depression, particularly in this case, we want to make sure that this particular problem is not related to psychosis. It is not secondary to any auditory hallucinations or false fixed beliefs. It's all false fixed. May God forgive us, okay? Now, and very important in this issue, you want to know related to the comorbidity, the social life, okay? Because usually these persons have difficulties in their social life, and if they have anyone to surround them, okay, anyone around them to help them. And physically, if you forgot about the physical, no problem, because the GP already assessed him and he only has this problem. Okay. Impact coping and risk, very important to ask him about this. It is not uncommon for them to attempt suicide, or it is not uncommon to hurt themselves. It is not uncommon to have bullying. These persons are exposed to bullying. So check it. How did this affect their life? Any bullying? And how is he coping? Okay, if he has ever hurt himself or attempted suicide. Past history and family history, not uncommon to have a particular problem related to this issue in this family. And finally, the diagnosis. I hope that it is clear for you. Ask about other than this, the comorbidities, everything is copy-paste sheet. And again, doctors, pay attention to the mark sheet and pay attention to the communication skills. Nowadays, the Royal College, I don't know why they are now giving it all to the role players to give their feedbacks, and the consultants just follow their feedback, and Candice can just maybe does not fail, does not pass because he did not have a good eye contact with the role player. So pay attention to the communications. So let's start with the technical issues, because they are the points which we should start with. You did identify the issues and priorities, and you recognize the aspects of the history and the different aspects of the history, like the impact, coping, risk, as I've said, the complaint. These are the main aspects of the history. And you explored enough the relevant symptoms and history, adequate skills and risk assessment. You did ask about them. You paid sufficient attention to the patient's physical health view when you asked me about if I know more about the problem and so on, and the complications of taking estrogen and so on. The psychological and social information, very Did you ask me about the stressors and bullying and anyone around will support me?
Yes, I asked if you are in a relation, or you
Okay.
mentioned sex. Okay.
So as you can see, Dr. Mahmoud nearly has scored all the history-taking task points, but unfortunately, according to the new way evaluation, because he was not empathetic enough and he approached sensitive issue bluntly, this he could take a formalic. He can lose this point. Consultation was formalic, and this might not help him to pass. Though for me, and also it was not very poorly managed because he was not able to finish in 7 minutes. So only 2 points in the communication, and these are only 2 points. Nowadays, the evaluation of the Royal College is puts considerable amount on the communication skills. So pay attention to your communication skills, Dr. Mahmoud. It's not a pass or fail, but I'm showing you your defects. So pay attention to them. I hope that you found it helpful. Thank you so much. You have another station. You can take rest, and we can see if anyone else would like to have a station.
Okay.
Dr. Rafa.
Yeah.
Yes,
Yeah.
it's very clever, Dr. Rafa. So what is your station, Dr.?
Body dysmorphic disorder. BDD.
Okay. Okay, I will share the station now.
Okay. Okay, I'm ready.
Okay. Just give me 1 second, please.
Yeah, take your time.
One, two, three,
Yeah, you
four.
know the name of the patient?
Robin.
Robin. Okay.
Yes.
Hello, Robin.
Yes, hello,
I
doctor.
am Dr. Muhammad. Hello, Robin. I am Dr. Muhammad, one of the psychiatrists from the mental health unit.
Hello, doctor.
Yeah, I understand that you have been referred by your GP to talk with one of our team members, and I am here to help you.
Well, I don't know, doctor, why am I talking to a psychiatrist? I'm not crazy. I wanted to have a plastic surgery, and I have discussed this with the GP. I'm expected to talk with a plastic surgeon. I'm
Yeah.
not crazy.
Yeah, Robin. I understand your query. So it's common to have a psychological evaluation before any medical intervention like cosmetic surgery. So we are all here working as a team, and I am here to help and support you. So is it okay to proceed?
Okay, no problem.
Yeah. So uh, could you tell me more about why your request for this surgical procedure?
Well, it's very obvious, doctor. Can't you see my nose, doctor? So it's very obvious. Okay.
Yeah. So since when you start to notice that there is issue with your nose?
Has been there since the early childhood, doctor.
Mm-hmm. And anyone around you sharing you same belief?
No. I understand that everyone around me is, is trying to be polite, but
Mm-hmm.
I'm sure I can see it though. I can see it, and all the kids used to say this to me.
Hmm. And so You did mention orthokets, so you did mention that it starts from your childhood.
Yes, yes, since a childhood I've
Mm.
been bullied because of the shape of my nose, but
Mm.
now I
Yeah,
decided to change this stuff.
I'm really sorry to hear about your difficulty, Ruben. And anything's happened led you to think about this cosmetic surgery now?
Yeah, doctor, I feel that I cannot have a serious step towards my life. I'm avoiding many social gatherings, and I'm also avoiding to have any intimate relations because I know that this issue is going to interfere with it. And I really want to change this. I broke up with my girlfriend because of this. I'm sure that she left me because of this.
Mm-hmm. Yeah, it seems that you are really passing through a difficult time. So, do you find yourself with time you are more preoccupied by the shape of your nose?
Well, it's always there, doctor. I'm always checking my nose in the mirror, so
Mm-hmm.
it's always there. But
Mm-hmm.
because now it dramatically affected my life, I must
Mm-hmm.
take a step.
So, you mentioned that you are always kicking your nose. How much time do you
Most of the
spend
time, doctor,
with
and
it?
I've watched the many documentaries about this issue and YouTube videos about the change of the shape of the nose, and I feel that I
Mm-hmm.
am suitable for this surgery.
Mm-hmm. And if the surgeon did say that your nose is okay and there is no any deformity in your nose, so would you accept his opinion?
Well, no, actually, I know that I can see it, doctor, and I feel that it is
Mhm.
there, and I'm sure it's not feeling. I'm sure that it's there, and I hope that you
Mhm.
help me with this.
Mm. So I can see you are pretty sure about the deformity of
Yes.
your nose. Mhm. And so, do you find yourself try to hide your nose or do a lot of
Yeah, definitely.
makeup, for
I'm wearing
example?
masks. Sometimes I prefer to wear masks, particularly if there is a
Mhm.
sort of female around me. I wear the mask that hides my nose because, as you can see, it's very big
Mhm.
and
Mhm.
distorted.
Yeah. And with all this stress, Robin, how is your mood been lately?
Well, I'm frustrated because this is a problem which I have no hands in it and I cannot fix it. I need someone to change it for me. And I hope that you help me with this.
Mm. Yeah, we are all here to support you. So, are you able to eat well and sleep well?
What?
Are you able to eat well?
Yes, yes,
Are you sleeping well?
yes, yes, yes.
Mhm. And because of this distress from what you are passing through, do you think life is not worth living?
What?
Do you think life is not worth living?
No, no, no. I want to live, but without uh, uh, this problem.
Mhm. And if the surgeon refused to do this cosmetic surgery for you, would you consider to do it by yourself?
Well, I'm going to
Or
set a complaint. I'm not going to accept this. Definitely, it is a mistake.
Mhm, mhm. And sometimes, Robin, people under stress people might hear voices when no one around. So, is that case with you?
No, no, no.
Mhm. Yeah. Thank you for all this information, Robin. I want to know how this problem impacts your life.
Well, as you can see, I'm trying to hide
Mhm.
my nose with masks, and I've avoided many jobs, which includes direct contact with the people around me. Though I have certificates for better jobs, and my emotional life is all
Mhm.
not okay because I feel embarrassed
Mhm.
and I can't take a step forward
Mhm.
towards anyone.
Mhm. Yeah, it's really difficult. I can see really this problem impact all aspects of your life, your relationship, your work. And how are you coping? You did mention that you hide your nose with mask, and you did also mention that you do a lot of makeup to cover
Yes,
your nose.
yes, yes. I
So,
put mask.
mhm. Are you coping by drinking alcohol
No, no, no,
or using any recreational drug?
no, no, no.
Mhm. And this is the first time to talk to psychiatrist about your
Yes,
problem, Robert. Mm.
yes.
Any family member has been in contact with any mental health
No,
therapist?
no.
Mhm. Okay. So thank you, Robin, for being open with me. From what we have discussed, I can see this
Time, time,
problem
time,
since
time, time. How do you feel about what we did? It was good
I
performance,
didn't.
very good, though I felt that you were a bit slow. Please try to be more fast in your evaluation. Try to use open-ended questions.
Mm,
And please, in the comorbidity, try to check if there is any OCD symptoms, because this can be
mm,
a particular part of the OCD, okay,
okay.
in the comorbidity and also anxiety in general. But everything was okay. When you finish the complaint and you want to go to the step of the checking the symptoms of the syndrome, please
Mhm,
use a sentence which we consider as signposting to show that you are now assessing a different part in the history. Let's see how we can do this task. I hope that you give her some feedback. She is very clever, but
okay.
definitely she needs your feedback. Okay. So in this station, you can have two scenarios. Either this patient who feels that his nose
Mm,
is not in particular is not does not look good. Another
mm,
patient, his eyes, and this particular patient, you must ask about the risk. Though this particular problem, you might feel, so what could be the risk there? In the eyes problem, he works as a taxi driver, and he did a couple of accidents while he was checking the shape of his eyes in the
mm,
mirror. Okay,
yeah.
so always ask about the risk. They are both of these stations are related to body dysmorphic disorder, but as you can see, particular station requires a different approach in which you must check about the risk. But if you have this risk assessment in your mind, you will not lose this point. Okay, as
Mhm,
you said, there are two scenarios, the one related to the nose, another one related to the eyes, and he will talk a lot of related to the eyes. He will talk a lot about his difficulties in the childhood because he was called fish eyes. Show empathy, okay?
mhm,
And all these are sentences which you can use as in the for empathy. Again, your plan when you see a history task, when they say to you, assess the patient to reach to a diagnosis, this is a history task. They can ask you to take history or assess the patient to reach a diagnosis. The history task is
mm,
mainly your clinical skill to professionally gather information from the patient to ultimately, at the end of the station, at the end of this dialogue, to reach a diagnosis. So this is your plan when you see a history task. You introduce yourself. As we said, the introduction is very important. It was good. Take the complaint properly. As we said, the complaint is not just tell me what are you doing. You must know the onset, you must know the course, and you must know
mm,
how was he doing before the onset, because nobody wakes up in the morning with a psychological problem. And the Royal College puts a lot of fix in the area of how was he doing before the onset, because they are now stressing to pass the candidates who are keen to assess the predisposing and the precipitating factors. So don't forget this while you're assessing the complaint. The symptoms of the syndrome,
mhm,
because after taking the complaint, you will understand definitely what is the problem of the patient, and you will assess him according to your knowledge about the nosology, the comorbidity. As you can see, if you reach the symptoms syndrome safely, this definitely you have finished not less than 50% of the task. And there is a 6 minutes rule. If you did not reach the step point number 5, the impact, coping, and risk, when you hear the bell of 6 minutes, immediately leave whatever you are doing, because you must cover these points: the impact, coping, and risk, past history, family history, in 1 minute. And it can hardly be sufficient to cover these points. So once you hear the bell of 6 minutes, immediately start point number 5, the impact, coping, and risk, ask about the past history and family history, and finally deliver the diagnosis. Introduction, very good that you introduce yourself in a very good way. As you can see in this station, liaison psychiatry in general, he is going to ask you, why am I referred to a psychiatrist? I'm not crazy. Very important question and standard answer. Though some can stumble and they don't know how to answer this question, because the role player is going to be very defensive when he says to you, why am I talking? When he asks, why am I talking to a psychiatrist? I'm not crazy. Why did the GP send me here? They are going to challenge your communication skills. If you answer this question very comfortably and assertively, you will pass, okay? But though it is simple answer, some can just stumble and they don't know how to answer the question. As we said, you take the complaint properly. You want to know the current situation, okay? Why he is asking to do a cosmetic surgery. Anyone is sharing his opinion, any cosmetic evaluation. And then you want to know, when did this problem start? Okay, anything happened at this time? And you want to know the course. So what happened after that? And you feel that the problem is there and it is increasing with time. Anything happened recently? So any problem starting since childhood, there is a big question which is raised. So if it is starting since childhood, not less than 25 years ago, so why now he wants to take a step to correct it? Definitely something happened. Okay, so you want to know the course, and you want to know how was he doing before the onset. And if it is a childhood problem, okay, so there is no problem if you don't ask about this question, because if it has been always there since the childhood. Now, the symptoms of syndrome, again, in order to make sure that you will cover this particular problem in depth, you want to ask about the thinking, the feeling, the behavior, and the childhood experiences. Again, any psychological phenomenon, if you are sitting in your clinic and someone comes to you with a new psychological problem which you don't understand and you have never read about, ask him about his thinking, his feelings, his behavior, and his childhood experiences. Definitely you will come up with something which will make the clinical problem clear for you. Now you want to know more about if he is thinking. So what could be there? If he is preoccupied with the shape of his nose most of the time, you want to check how much he is confident about this, okay? And you want to know, this is two questions, if he is convinced, and can it be really nothing wrong with his nose, how much he's convinced. So these are two questions which give the same meaning. And you want to know what is his thought if the plastic surgeon is going to deny his request. So these are his thoughts. You want to know the degree of distress, his feelings. So he must be very distressed in order to be very determined in taking this step. So if he is going to be distressed from 1 to 10, definitely will not say nothing less than 8 in order to be very sure that he is going to take this step. And you want to know if he is feeling, less confident because of his nose. Now you want to know his behavior, as I said, very important, because if there is any sort of camouflaging, his deformity, if he is avoiding anything, how frequently does he check this? So there is a consistent behavioral changes related to this, and you will find that it's not just a simple behavior, it can be a very dramatic behavior, like avoiding social gathering, avoiding very important jobs because of this problem, or okay. The childhood experience, definitely the body dysmorphic disorders related to a particular childhood experience. Okay, again, doctor, thinking, feeling, behavior, and childhood experiences. Okay, so far everything is clear. Any question related to how to assess this syndrome? Thinking, feeling, behavior, childhood
No, it's clear.
experience. Okay,
Yeah.
yes, no. Okay, then the comorbidity. In this particular problem, the only mistake which you should have checked, we know that comorbidities might, the irregular assessment is for depression and psychosis, but sometimes particular comorbidity should be checked first, like the anxiety and OCD in like this case. So in this particular problem, try to check the anxiety and the OCD and then check the depression and then the psychosis. Uh, Very important to check his social life if he has a job, okay, and if it is affected his life, and so on. And physical problems, very important to check for physical problems. Now, the impact, coping, and risk, as we said, the rule of time management. If you hear the bell of 7 minutes, 6 minutes, immediately start the impact, coping, and risk to make sure that you will cover the task in 7 minutes. Okay, how did this affect his life? How he's coping with this? Any thoughts of harming himself because of this? And then past history and family history, and then finally delivering the diagnosis. Okay, how that everything is clear related to how do we assess this? Okay.
Okay.
Now, how we are going to be assessed in the mark sheet. Now, very good. I think technicalities, you have covered everything. You did identify the priorities and the important issues. The main headings of the history you've covered. You did explore enough the relevant symptoms. You did demonstrate risk assessment skills, and you did ask me about my point of view. How do I feel about? So I felt that you are engaging me. The psychological and social information you have covered. Your communication skills are good, but only for one thing, your management of time should have been better. That's it. Other than this, no problem. If you practice it once or twice, you will not feel any problem related to this station and the time management. But all in all, it was good, very good. I'm not here to say who will pass or fail, but definitely you're very clever. Thank you so much.
Thank you, Mr. Hassan. Thank you.
Who would like to go next? Who would like to go next, doctors? Dr. Mahmoud.
Yes, or I can do the wet game, psychosocial.
Pay attention, psychosocial history. You have 2 minutes, write down your thoughts and arrange your notes and see. I'm very clever, by the way. Okay, ready? I cannot hear you, though.
And your name, doctor?
Let's say my name is Michael.
All right.
Okay. 1, 2, 3, go.
Hello, Michael. I'm Dr. Suleiman, one of the mental health doctors.
Hello, doctor.
I understand that the GP has referred you to us because you have some concerns about your weight, and we are here today to discuss this issue and see how we can help you move forward. Would that be okay?
Yeah, no problem, Yes.
Well, I understand that speaking about weight and eating habit might be sometimes sensitive and difficult. Would it be okay to proceed?
No problem.
So can you share with me, Michael, the difficulties you're having?
Well, I've gained weight, doctor. My weight now is about 120 kilograms, and I think it's all because of the medications. I've discussed this with the GP. He said that I must talk with you before taking any step.
So, and you are now 120. So how much weight have you gained?
Well, not less than 20 kilograms, doctor, since I've started the medications.
And when did you start the medication?
About 1 year ago.
Okay, so you gained 20 kilogram over a year?
Yes.
Okay, right. So what medication you think is related to weight gain, Mike?
Well, since I started mirtazapine, I think and he increased the dose about 6 months ago. It complicated the case. And I
Sorry to
also
hear
take
that.
sodium valproate, so I'm taking two medications which I read that they increase the weight.
Hmm. And may I know why your doctor prescribed mirtazapine for you?
I've been diagnosed with bipolar mood disorder.
Okay, right. And how has your mood been lately?
Well, everything is okay, doctor, but I'm really bothered by this weight.
Yes, it must be very difficult. I understand that. Well, so in what way you think, Michael, that mirtazapine has increased your weight?
Well, it's also started because of the after taking metazapine, and increasing the dose. I feel that my weight is increased, and I don't want to know exactly if this is because of medications and or if I can change it.
Hmm. And have you had difficulties regarding weight gain in the past?
No.
Okay. And do you have any family history of weight problem?
Yeah, yeah. My daughter, my sister, also is suffering from weight gain.
Well, so you mentioned that you have bipolar, and sometimes people deal with like difficult times or stress by coping by eating. So has it been the case with you, Mike?
No, 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 no. This is not the case.
All right. Okay. So can you take me through your eating habits? So what's your typical day of eating?
Well, I'm quick as a computer technician. There is no particular diet, whatever is available, fast food. I all choose the rapid delivery. You know, if it is a diet or a snack which is rapidly delivered, I choose it. I don't focus much if it's healthy or no.
Mm.
That's it.
Did you drink like fizzy drinks?
Yes, yes, yes.
All right. So what about using alcohol?
Yeah, I drink alcohol with the meals 3 times a day. Beer mainly.
Is there any other recreational drugs?
No, no, no.
All right. Okay. So you mentioned that you work as a IT technician. Do you have any chance to do exercise or walk?
I used to be football player, but I had injury in my knee, and since then I just cannot do running as before and or jumping, and so I stopped doing any physical exercise.
Sorry to hear that, Michael. Well, so saying that, what sort of impact has weight gain impacted your life?
Well, I feel not comfortable. I'm losing confidence in myself. I feel that my blood pressure is increasing. I'm not happy because I feel now I must change all my clothes nowadays. Now it's not me. You know, I've been active, sports active all my life. Now I feel chumpy and large. I don't like this.
Mm. Well, it seems that you've been going through a difficult time, really. And
Yeah.
I see that's impacted you in different areas, and you feel less confident when you gain weight. Has it
Yes.
affected your relationship with others?
Well, I have to be honest. Yes, I'm still not in a relationship, and I think being overweight definitely affect my chances.
Can you give me do you have any kind of social support at the moment?
Yeah, my family around me, yeah, no problem with them. But as I said, it's my relation with the other, with girls, and I feel that I'm not very comfortable if my weight is like this.
Well, so I'm happy that you came today, Michael, to speak about this important issue. I think that the GP has done some blood investigations. Has he told you about the results?
No, he said that I must discuss with you.
Well, so I'm sorry to tell you that the blood investigation showed some increase in the unhelpful or harmful fat in the body, like cholesterol and the triglycerides. Also, your blood pressure was a bit high. So, just and speaking about this
1 minute
issue,
remaining.
so that's why we are addressing this issue today to see what we can do just to help things getting better. How do you feel about that?
Well, no problem, yes.
Okay, so as you might be aware, lifestyle modification is a very important step in controlling weight. Are you willing to take any steps to in this regard?
Yeah, no problem. I wish that you can help me, yes.
All right. Okay. So I will refer you to a dietitian to speak with you about the diet plan. Also, we can refer you to a physiotherapist. I know that you have need difficulties because of weight, so he can design a exercise program for you.
No problem.
Also, as you mentioned, alcohol and maybe smoking, if you smoke, can attribute more to more physical health problems. So I can refer you to this service to speak about with you more about how they can support you moving forward. Would that be okay?
Okay, no problem.
Okay. Okay. Thank you so much.
Time, how do you feel about what you did?
Well, I feel I did well, really.
Yes, you did well.
Okay.
Okay. Yeah, I hope that you give him any feedback, doctor. Okay, so I don't know why no one is giving feedbacks. So pay attention to the following. So the task is one, doctor. The task is to take the psychosocial. So you did not ask me if I took any medications, other medications, any other admissions. Uh, you were sufficed by saying that I'm okay. Yes, I'm controlled now, but
هذا تقريبا من فضل.
okay, dear doctor. So I hope that you just mute your mics. This will be more helpful. Okay, so pay attention to the psychosocial. They want you for you to take psychosocial. So ask me more about not only the symptoms of the problem, psychological problem. You want to know more about the medications. You want to know more about any previous history of admissions. So this is the first part of the psycho history. Now the social history. Please don't forget that one of the most important factors in gaining weight is the smoking and the sleeping habits. You miss them. Many candidates don't ask about sleep. Sleeping habits affect the weight dramatically. Those who have weight gain problems usually have sleeping problems. Okay, like snoring or having this apnea, sleep apnea, and so on. Okay. Other than this, everything was okay. I like that your introduction and in the beginning you were keen to be empathetic while you're asking about this problem. Uh, you were very accurate in understanding how his condition is now and how many kilos did he gain, and also uh, how was he doing if this is the first time for him to gain weight. But pay attention to the following, that at the end of the station you must tell him that it's not only about the medications, because you must tell him that there are many factors in his life which behind the weight gain. You went through the details of the management which could have been spared, but you must explain to him at the end that there are many factors in his life which can be behind this issue. related to the weight gain, like the unhealthy lifestyle. Okay, and definitely the medications have been documented to be related to the weight gain, but this type of weight gain can be controlled in a great extent by the healthy lifestyle. And ask him about the motivation. You wouldn't have needed to go through the details of his of the management. Okay. So the complaint you ask about, as we said, the introduction was good. You were very empathetic to tell him that the weight gain and eating habits are sensitive issues, and you took permission, very clever. You took the complaint. You want to know the current situation. You want to know the onset. You want to know the course and how was he doing for the onset. Okay. And before the onset, he never gained weight before. But if you were just paid attention that my weight now is 120 kilograms, and before gaining this 20 kilograms, I was 100 kilograms. So I was already above the average. I could, okay, so you should have highlighted this. So I understand that you've been already 100 kilograms before taking these medications. Did you feel that you were overweight at this time? Just highlight that his lifestyle before taking the medications was already putting him in the overweight category. Okay, are you with me, Dr. Mahmoud?
Yes, doctor.
Now, taking the symptoms of syndrome, as we said, the history is the psychosocial. Everything was okay. You assessed my mood, but you should have taken it in more depth, particularly the medications, and if there is any psychoses, any the previous admissions. Okay, very important. But this is the only thing which you would be considered as very important, and you have missed because it is the task. Thank you. Who is doodling of this on my screen? Don't step. Don't mess up with my screen. Who's doodling? What is this line? Okay. Now the comorbidity. Now the area or the part of the comorbidity is the area in which you are going to do the second part of the task. As we said, it is taking history related to his psychosocial. So the comorbidity is the part in which you are going to check if there is anything in his social life related to the overweight. Everything was okay, except that you missed the sleep and the and also the what we said, the sleep and what
Smoking.
smoking. Yes.
Yes.
Impact, coping, and risk. Very important that you ask about them. How is he coping and how did it affect his life? And past history and family history, very important to ask these questions because as we know that the overweight can run in family, there is a genetic factor behind it. Ask about them and delivering the diagnosis as finally, there is no diagnosis here, but you must explain to him that there is an overweight problem, but it's not only because of the medications. He has been already in the area of overweight before taking these medications. But all in all, it was very good. I like your communication skills. Please, doctors, nowadays focus on how you are going to do the station, not what are you going to say or what questions you are going to ask. The empathy and your communication skills are now very important in the evaluation of the canvas. Okay. I'm not going to go through the mark sheet again. You already know how to be assessed. So thank you so much. Who would like to go? Have we finished? Anyone will, have we finished?
Can I do drug-induced mania, Dr. Hassan?
What
Is it
station would
okay?
you like to do, Dr.
Drug-induced mania.
Okay. What? What station, Doctor?
Drug-induced
Drug-induced mania.
drug-induced.
Yeah. Yeah. Drug-induced mania. Yeah, 22 minutes. You have 2 minutes. Write down your notes, arrange your thoughts.
Okay.
Okay, ready?
Yeah.
Very clear. So
May I know the vision?
let's say that my name is Mrs. White.
This is one. Okay. Yeah, ready.
Muhammad Badr, no, he asked about, well, as we said, doctor, he should have asked about the medications in depth. Okay, so thank you so much for your feedback. Okay, let's start. 1, 2, 3, go.
Hello, Mrs. White. I
Hello,
am Dr.
doctor.
Muhammad. I
I
am the
can see that. I
psychiatrist
can
from
see
the
that you are
International.
from. You are not from UK. Maybe you are from Africa. Or can you tell me more about Africa? From what country you are from? Because there is a chance that I want to go there. I want to live my life. I'm now 65 years old. I think that I've missed a lot. Maybe if I can go to your place, I can feel better because I want definitely to have new
Mrs. White,
experiences in life.
I'm really sorry to interrupt you. We are here to discuss about you. As I understand from my notes that the GP referred you as your family, it seemed to be worried about you. So,
Yes, doctor. Well, I don't know why he is worried, doctor. I feel happy. I feel that I'm now
mm,
in control of my life. I can do things now which I couldn't do before after
mm,
changing my medications by
I
the
can see
neurologist.
you, Mrs. White, I can see you really happy and elated in your mood, and it seems you have a lot to say. Do you feel you have a lot of thoughts in your mind?
Well, there are lot of changes I have noticed, doctor. Like,
Mm,
I feel now that I'm more attractive. I can feel that men are looking at me and they are paying attention more
mhm,
to me, doctor. And a lot of things which I want to do because
mhm,
I've been diagnosed with Parkinson's, which I felt that it was, hindering me. But now I
mhm,
feel that I'm more free. There are many things which I've missed in my life. I want to do
mhm.
them. Well, can you tell me more
So you did
about?
mention that, Mrs. White, you mentioned that you are pretty and attractive. So do you think you are unique and special person?
What?
You mentioned that you are attractive, you are beautiful. Do you think you are unique and special person?
Well, I'm not special, but I think that there are many things which I do in my should do, many dreams which I should
Mhm,
fulfill. Because, for
mhm.
example, I can do
So,
definitely I can open a restaurant which because I know how to
mhm,
cook.
mhm. So I think you have a lot of things to do. So do you have energy to do all this? This is why.
Yes, definitely. I have a lot of energy now. I only sleep 3 hours, so definitely there are a lot of things which I can do and a lot of energy.
Mhm, mhm. And you did mention that you thinking about open restaurant. So could you tell me more about this
Thinking of what?
idea? You did mention that you want to open restaurant. Am I right?
Yes, doctor, because I want to open it in Mauritius. I will sell my house here. I want to end my relationship with my husband because he is not faithful. He's definitely having a relationship with our neighbors. And now
Mm-hmm,
I feel
mm-hmm.
that I want to change my life. I want to have a new life with someone who is more faithful. I can open
So
a restaurant in
it seems that
Mauritius.
Mrs. White, you have a lot of new interest, and you did mention about your husband. So he is unfaithful for you. Are you sure about that?
Yes, definitely he's having a relation with our neighbors because usually they disappear with the same time, both of them. I've noticed this for a long time.
Mhm.
He has been my husband for 40 years, but definitely now and I know that he is having this affair. I know this. I've noticed this for 40 years.
Mhm. Okay, so Mrs. White, since when you are feeling high in your mood and you are happy and elated? Since
What?
when you start to feel? Since when you start to
Well,
feel that you are having?
it all started with me about 1 week, one month ago, doctor, because I think
Mhm,
now for 1 month I feel that there are many things which I should do. I don't know why did the GP send me here.
mhm.
I just
And
want
how
to
are
live
you
a life.
doing before these 1 month? How are you doing before this one
Well, I
month?
had
Is there is
some
any stress?
problems in my movement because I have been diagnosed with Parkinson's disease, but the doctor is very
Mhm.
clever. He
I'm really
changed my
sorry.
medications. And since then, I feel dramatic change in
Mhm,
my life, dramatic change in the way I move. He's very
mhm,
clever. I feel now I can fulfill
mhm,
my dreams now.
mhm. So I understand that all this is started about your GB change your medication. May I know your
My
medication?
neurologist, not GP.
Mhm. Okay, your neurologist. Okay. So you are taking anti-Parkinsonian medication. Am I right?
Yes, yes.
Mhm, mhm. And mm, uh, are you the one person who are you interested in? You did mention that you have this new interest. You want to open restaurants. So do you have time to eat well and take care of yourself?
Yeah, a lot of time. Yeah, yeah. I bought a
Mm,
lot of cosmetics because I understand that definitely um, I need to take care of myself and I need a new relation because definitely my husband is not faithful.
And are you eating well?
Yes, yes, yes.
Mhm. All right. And thank you for all this information, Mrs. White. Sometime when people are elated and happy in their mood, may hear
1 minute
voices
remaining.
when no one around. Is that case with you?
Like again, what is the question? Sometimes you do what?
Hearing voices when no one around?
No, 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 no,
Mhm. Are you coping by drinking alcohol?
no.
I'm really worried about your safety, Mrs. White. So, are you driving
Are you what?
now? Are you driving now?
Yes, I took some tickets because I'm speeding. Yes.
Mm-hmm. And do you find you did mention that you have a relationship. I beg your pardon. Do you find yourself more interested in intimate relationship
Yes,
these
yes,
days?
yes, yes.
So thank you for all this information, Mrs. White. I can see that all this happened to you due to after changing your medication, anti-Parkinsonian
Time,
medication,
time,
and
time, time, time. Okay. Again, doctor, you're very clever, but please pay attention to the
mm,
time management. Everything was
mm,
okay in your assessment, except that in this particular station, you must. This she is an old lady. Sometimes they said here that you should check for the etiology, the task. So one of the etiologies or one of the clinical picture which can have the same presentation or very close presentation to mania is the frontal lobe dementia. So you should have asked about the
memory
memory.
impairment.
Okay.
Mm,
And you wanted to know more about her medications. What are the what is the dose? How much did it increase? So as I said to you, it changed. I've changed the medications. I expected from you to ask me more about the medications regarding the dose and if she's taking it regularly. Okay, how much did
mm,
it increase? You
mm,
were very empathetic. You did occupy this particular patient, which the most difficult thing in this station is the manic presentation of the patient. As you can see, she is trying to talk and talk and talk. And if you did not take control of the consultation by addressing her name regularly and setting limits, you will lose the station. And try to be empathetic and smooth. Don't, set her back in a blunt way. If she tries to say a comment, just say thank you. Thank you for your interest in my country, but I would like to help you in the beginning to make sure that everything is okay regarding your safety and your clinical condition. It's okay to proceed like this. Okay.
mm,
Try to be empathetic when you refuse or try to not go with her distraction. So let's see how we can do this station according to my. Let's see the feedback of our colleagues. Someone said something. Well, doctors, I don't know, Dr. Sahar. Yes, definitely. Well, how come did you come with us in this without being in the group? Okay, you can just send your contact number to me on this number. Just send me your name and contact details on this WhatsApp number. Okay, so I've just shared. I don't know how come you're with us without being the group. Okay, anyway, you're more than welcome, doctor. More than welcome. Okay, so we're going to share this. Yes, drug inducement. These are some sentences which are going to use, which will help you to show empathy. I know that the EIMGs can have difficulties because of their language in using the empathetic sentences. There are some sympathetic sentences. Don't underestimate this, please. Don't underestimate, because it's all now considerable weight on your communication skills in whether you are going to pass or fail. So please don't put yourself in this situation because you don't understand how or what is required from you. The task is simply a game. Some task is game. You can be very, very clever. And actually, there is a paradoxical thing in the results of the task. Professional doctors who have long history of experience do not pass as much as those who are newbies. And this is simply because the newbies are willing to accept the advice, are willing to check what is required from them, are willing to practice more, are willing to approach the exam like a junior, while the professional doctors depend on their experience. They don't pay much attention to what is required from them, and they don't practice much. And they don't ask much about what is required and what is not required, well, depending that they are already experienced, and indeed they are experienced. But being experienced in your clinical life does not mean that you are going to pass the task. Task is a game. Understand the rules of the game before playing it. Okay, please don't forget this. You must understand the rules, and now the rule is to have good communication skills and to show empathy. And here are some sentences which can help you to understand how to approach the patients empathetically. Now, your introduction was good, and pay attention that this patient needs to be in control and to set limits and take control of the conversation from the very first beginning. Otherwise, you will lose the station. She will keep talking without adding any information. Okay. Now, while you're taking the complaint, you can use this to show that you are also addressing the symptomatology, like when she talks fast, say something like that. I can see that you have a lot of things to say and a lot of energy. Do you feel that you also have a lot of thoughts in your mind? So all this while you are taking complaint, you are also highlighting the symptomatology. You are doing two things. You are assessing the syndrome, and at the same time, you are taking the complaint. And definitely in the station, she will appear very happy and elated and excited. Comment on this. And I can see that you're elated, excited, etc. Very important to ask in the complaint when all the trick here is in taking the complaint in the right way. And this is a typical example in the task about how they are going to set tricks. If you take the complaint properly, you ask about the current condition, the onset, the course, and how was she doing before that. So if you ask about the onset, it all started about 1 month ago, and the course, do you feel that your mood is increasing with time, and anytime you felt the opposite, like feeling that you are sad, no energy, and so on. So I understand now it's not 1 month ago, but I am wondering how were you doing before that, and ask specifically. Now this is an open-ended question. So and you need an extra three closed-ended question: any stressors, any street drugs or alcohol, any change of medications, and so on. Okay. Now the symptoms of syndrome, please. In the mania, in particularly the mania, the candidates sometimes, because the patient is trying to distract you and he's trying to talk rapidly, they forget the items of the mania which you should ask about. So this is an acronym which you should study by heart. Meet Maxa. For me, it was very difficult to assess a patient with mania because I have exam anxiety, and they bring a role player which keeps talking, and trying to distract you. It was a bit challenging for me. So this is the acronym. You can have your own acronym, but pay attention that it will be very challenging in a mania station to assess the patient's mood in depth because he keeps distracting you. So you want to ask about the mood, the energy, if he has an hedonia or a new interest, and the thinking, if he is thinking fast, and so, and if there is any particular mission or abilities, how much his confidence, sleep, and appetite. All these are the meet max up. This is my own acronym. If you ask not less than 5, it's okay. This will be considered as in depth. Make sure that you ask the mood and sleep, appetite, and choose anything, any other two. So mood is very important. Sleep, appetite, the vegetative symptoms are very important, and choose any other two. This will be considered from my perspective enough to be assessed as that you already covered the syndrome in depth. Now the psychological, because she's an old lady, don't forget to ask about the memory. Any old patient, always put in your mind that this is a patient who has a chance to be suffering from dementia, particularly if she's already diagnosed with Parkinson's. This is very important. If you want to appear that you are experienced and professional, definitely the consultant will notice this, that you are going to ask about the memory because frontal lobe dementia can have similar presentation. The usual psychological associations like the psychoses, and then physical condition. Very important to ask about the physical condition, the medications, any change in the medications, when was this. This is a place in which you can ask for the comorbidity, and also you can ask about this when she discussed with you about how was she doing before the onset. So if you miss this, checking if there is the etiology in how was she doing before the onset, when you check about the medications and change of the medications, here is another place in which you can catch up with this particular important point. Very important to ask her about her social life because definitely this lady is going to do some dramatic changes in her life with this high mood. Okay?
Okay.
You ask about the impact, coping, and risk. And again, doctors, your time management is very important. Once you hear the bell of 6 minutes, immediately start asking about the impact, coping, and risk, past history and family history, and finally delivering the diagnosis. I have this station and I posted when it came the very first time. She will ask you, so why do you consider me ill? What's wrong to be happy? Is it wrong to be happy? You can simply ask, tell her, understand and respect your point. However, there is a considerable risk because you're with high mood, and this requires medical attention. That's it. You don't need to go through more than this. Risk because of this high mood related to the change of the medications, and this requires medical attention, and that's it. Thank you so much. Okay, I'm not going to go through the mark sheet, but please, doctors, please, 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 when you try to do your practice with your colleagues, always make sure that the mark sheet is in your hand and you assess yourself and your colleague according to the mark sheet, not according to what you feel, not according to your perspective. With you all, my respect to all of you. As I said, the COSC is a game, and the rules of the game is the mark sheet. Okay, the rules of the game is a mark sheet. If you don't play with the rules of the game, how come you are going to pass? Yes, yes, this is one. Yeah, this is a good presentation. Definitely, this is your friend. Good presentation, yes. Okay, thank you so much, doctors.
Thank you.
Okay, I wish that 8 stations would have been covered, only 4 stations. Okay, no problem. I hope that you try to engage more in order to make sure that we cover as much as possible of the stations. I can hardly find time for these types of Zoom sessions. Anyway, if before the beginning of the sessions, if doctors prefer to take more stations, and because of the available slots, no problem. If he takes or she takes 2 or 3, no problem. Okay, let's see the good presentation. Yeah, thank you so. Thank you, doctors. Thank you, dear doctors. I wish to see all your names in the post list. Still there is
Thank you,
time.
Dr.
If so, still there is time, doctors. If you, any one of you, feel that he is behind in his practice and revision for any reason, we all have life issues. Still there is time, but try to be focusing and dedicated. Not less than 4 to 5 stations a day, one task at a time, finish the management, the mental status, history. The physical exam stations are very difficult, very easy to pass if you practice them properly. Physical exam stations are easy to pass, straightforward, but needs a practice and definitely needs a physical presence of a colleague. So this is the main issue with this type of stations. You need physical presence of another colleague to practice physical examination on him. Also, the explanation stations are very easy to pass, and you need to read them thoroughly. Okay, have a good night. I used to see all your names in the pass list. Okay, and please, doctors, don't take any courses or any mocks before studying and doing your homework. Please don't waste your money. If you don't study, going through the mocks and taking courses is not going to change anything except wasting the money. These courses, if you are simply just to give you an idea about the exam and to vaccinate you from the anxiety of the exam. If you are not going to study, you are not going to change anything. Okay. Have a good night. Thank you so much. Thank you.